there really is something we should be going to war against. The U.S. has a powerful enemy that could succeed in destroying us. It's undermining the economy, it's destroying businesses, it's wrecking families, it's driving people into bankruptcy and destitution. And that enemy is our profit-driven monstrosity of a healthcare system.
An estimated 2,000 advocates for single-payer health care gathered for a rally in Upper Senate Park on July 30th, which was also, not coincidentally, the 44th anniversary of Medicare. They are here to lobby on behalf of H.R. 676, a bill introduced in the House of Representatives that proposes to solve the health care crisis by expanding Medicare to include all Americans. Lobbyists, many of whom are healthcare professionals, voiced their concerns about the current system.
It needs to be changed because we're treating people as they get sick. We need to help them maintain a healthy life, and the best way to do it is to provide them with health insurance, no matter what, no matter if they have a pre-existing illness, no matter if they have, something that occurs after they get the insurance. We don't need to deny, experimental treatments. We need to just help everyone.
I gave up practice because, frankly, it was very hard to practice medicine in this country, and I cared too much about this whole issue about health policy and where we need to be going in this country. So I decided I wanted to devote most of my efforts to trying to fix our healthcare system.
The bill has received little media attention as compared to other proposed healthcare plans. Supporters cite the Congressional Budget Office's failure to score the legislation for its cost and cost-saving ability. This despite the fact that all sides of the debate agree that any legislation will need to reduce the ever-expanding cost of health care.
The cost of health care is increasing annually 4 times the rate of the economy. And how do we pay in our public programs for health care? But with tax dollars. And tax dollars are directly related to the growth of the economy, but health care is growing 4 times faster than those tax dollars. This is an equation for failure. It only gets worse and worse until we get rid of the middleman.
Well, I think there was a time when healthcare was not nearly as expensive as it is now, and people probably there were more people who had health insurance. But it's gotten to the point now, particularly with this most recent recession, where there are way too many people who have no health insurance. The costs are skyrocketing out of control, and the system is totally broken. And it's time for us to really start over again. And as President Obama said, if I were to start over again, we should do a single-payer system. It's the only way we can cover everybody at less money than we currently spend, and that's what we're asking for today.
If H.R. 676 becomes law, citizens would be covered under a government-run health insurance program. The private health insurance industry, as we know it today, would become redundant.
If I were to look at how I spend money on healthcare, out of every dollar I spend, about a quarter goes to an insurance company. That insurance company doesn't really keep me healthy. There's no proof that they do. I may leave that insurance company in a year or a year and a half, so they have no reason to try and keep me healthy. What they do is collect my premium and then pay for some of my care and not pay for some of it also. And they're very good at not paying for care.
And that's an incentive for them. That's the point of an insurance company existing. That's
Right.
the incentive for them, is they collect as much money as they can and they give back as little as they can. Whereas a government-run healthcare system, that would not be the point. We would be trying to cover everyone, and we would be in the system all of our lives. As Dan said, when you're with an insurance company, you're only with them for a couple of years maybe. But we would have incentives to prevent things from happening to people.
The 47 million Americans currently uninsured may agree with this assessment, but the majority of citizens are satisfied with their coverage, and the insurance industry, a powerful force in its own right, recognizes single-payer health care as a threat. For this reason, more than any other, Beltway insiders believe the bill has little chance. Despite these dire predictions, supporters believe that H.R. 676, like Medicare, the government program upon which the bill is based, is our best option for controlling costs and expanding coverage.
Medicare is working, President Obama. Since 1965, poverty among those over 65 has been reduced by 60%. Thank you, Medicare. And we know that Medicare, unlike the private insurers, actually contains costs.
Every statistic shows and bears out that universal, single-payer health care is the most efficient healthcare system of delivery.
Most doctors will tell you that Medicare is far and away the easiest program to bill. There's one form, you send it there, you get paid within 30 days. Private insurance companies, there are all kinds of qualifications before they decide that they're going to pay your bill, and there's an incredible amount of hassles about that. So it's much, much easier under the Medicare program, which is our closest analogy to single payer in this country.
H.R. 676 has 93 co-sponsors in the House and unflinching support from the progressive left. Despite this, it isn't just private insurers that fear single-payer health care.
People are afraid of single payer only because the insurance industry, the pharmaceutical industry are spending $1.4 million a day marketing the problems that they think about single payer. But the truth is that it would basically threaten their existence, and it would actually allow us as Americans to provide health insurance for everybody, but at their expense, and that's why they are afraid of single payer.
You know, people are afraid of change, and sometimes we say the status quo is everyone's second choice. But we need this change because we've been fighting for 15 years to get it, and we may not survive if we don't.
So I think we should appeal to the patriotism of our representatives and say, since when does the United States back off from a fight because the enemy is too big or too well entrenched? And I would say to you in the Congress and the Senate, fail to act will be seen by us as cowardice. Fail to act will be seen by us as treason.
In Washington, D.C., this is Leanne Scott.